Having a serious lung problem, whether it is a loved one or yourself, isn't easy. Acute respiratory distress syndrome or ARDS is a life-threatening illness where the lungs are severely inflamed. This swelling prevents the lungs from working well. Patients with ARDS have problems getting oxygen into their blood, so they must be given extra oxygen and will usually need a ventilator to breathe. Currently, there is no specific treatment for ARDS. Treatment consists of two goals. 1. Treat any medical problem that led to the lung injury, and 2. Support the person's breathing, usually with a ventilator, until the lungs heal. Most people with ARDS are treated in a hospital's intensive care unit, which is also called the ICU. ICUs are where the most seriously ill patients are cared for by a specially trained healthcare team. The ICU team includes doctors, nurses, respiratory therapists, dietitians, physical therapists, and other specialists. The ICU team works together closely to provide the best possible care. Patients in the ICU are often connected to several machines, monitors, and tubes which help the person recover. It can feel overwhelming to see all this equipment, but you can ask a member of the team questions to help you understand what is happening. Therapies commonly used to treat people with ARDS include breathing support from a mechanical ventilator, often called a vent, medicines to keep the person calm and comfortable while on the ventilator so that they can rest and recover. Healthcare providers may try to keep a person with ARDS awake on the ventilator in order to participate in physical therapy to keep muscle strength during their illness. Other medicines may include antibiotics to treat bacterial infections, medications to increase blood pressure, medications to get rid of excess fluid, and blood thinners to prevent or treat blood clots. In addition to medicines, other ways to help patients with ARDS include prone positioning, which is when the patient may be placed face down for periods of time to help the lungs work better, a temporary feeding tube placed through the nose or mouth into the stomach or small intestines to provide nutrition, and tracheostomy, a surgical opening in the neck for longer-term support from the ventilator. ARDS is a serious, sometimes fatal medical problem that can also be very unpredictable. Some people recover within a short period of time, while others may not recover for weeks or months. Some people have no complications at all, and others seem to develop many complications. Some people with ARDS die quickly, while others die after a prolonged illness. The ups and downs of this critical illness may seem like an emotional roller coaster for everyone, patients, families, and friends. Yet, many people do survive. It is important for family and friends to remain hopeful and seek guidance on how they can help promote healing. It is also important that family members take care of themselves to avoid getting too tired or worn down. Talking with the healthcare team to understand what is happening and what might be expected day to day can be very empowering. For more information, visit ardsalliance.org.